now speak with the Ashanti Region GMA President, Dr. Parkwesi Beidu, who joins me via Zoom for more. Are you aware that the region has only 5 beds for critically ill COVID-19 patients?
Yeah, good evening, Aisha. Good evening to your listeners. Yes, what my colleague said is right. And in fact, it's an analysis that was done by us. What I mean by us is the Ghana Medical Association in the Ashanti region. So we looked at the situational report in the region, and then we also went to the treatment center. Luckily, Dr. Hammond is also an executive of the Ghana Medical Association in the Ashanti region. And so we did this analysis, and we realized that on daily basis, Ashanti region records between 150 to 170 patients. And out of these, 5% translating to between 7 and 8 patients daily coming in as critically ill or severely ill. And on average, each critically ill patient spends between 15 to 21 days. So you can look at the disparities. And then we looked at the capacity of the treatment center. And as he rightly said, it's only Konfanoche that is seeing the critically ill patient. And it's not even a proper ICU. It's just a ward where 5 beds has been dedicated to the management of critically ill, 5 out of the whole lot. The whole treatment center is 25 bed capacity. And if you are getting on average 8 patients coming in. So we did this analysis and other proposals and presented same to the Regional Director of Health Services, Dr. Chinkwan. We met him at his office together with the Deputy Director of Clinical Care a week ago, I think last week, Friday. And we presented a paper on our analysis and also what we think should be the way forward. And it's instructive to note, when we met, the picture painted was so gloomy. Aside Konfanoche, as we said, the regional hospital that sees Kumasi South is the regional hospital. They are supposed to take care of, is like the Greater Accra Regional Hospital for Accra. And the whole region, the whole Ashanti region, I mean Ghana Health Service, doesn't have a single doctor anesthesiologist. And the whole regional hospital has just 2 critical care nurses to deal with. Oh yes, that's the situation in the region. And this was after we did this analysis, and when we met the Regional Director of Health, he confirmed that. So you realize that it's only Konfanoche that has doctor anesthesiologists and some critical care nurses. So the proposal we put forward was, 1, we were proposing the use of the Bekwai Hospital, which was commissioned recently, I think last year, by His Excellency the President, that if we can have a centralized, we have splinter facilities taking care of the COVID patients. So we are not surprised we are losing so many patients. So we wanted a centralized facility where we can concentrate the limited resources we have in dealing with those who are severely and critically ill. So we made this proposal that, look, we could use the Bekwai Hospital, but then we were told they've already started using it, so that's not going to be feasible. The other facility that was proposed was the Frimpong Boateng Medical Center, which is on the table. But then we're told by the Regional Director of Health Services that the Minister of Health, I'll say designated, I don't know whether he's been confirmed or not.
Dr. Beidu, I guess this is affecting or it's impacting critically on COVID-19 care. But have you engaged the Ghana Health Service about this situation?
Yes, as I said, we met the Regional Director of Health Services, Dr. Chinkwan.
Keep quiet, I'm coming to.
Yes, last week, Friday, on this issue, and we also we made this analysis and also submitted the solutions which we think will help address this. Because now we have a lot of people being managed in private facilities. They are dying in these private facilities, and he attested to that. And what is making it serious is these people die, and the private facilities tell their relatives that, oh, it was just a pneumonia, when in actual fact they were COVID cases. So instead of following the normal protocol for handling suspected COVID deaths, they are sent to private mortuaries. So you realize that the tests are not even done. So that's the situation in the Ashanti region, and it's impacting severely on the management of COVID-19 cases.
In the interim, how do you intend to resolve this issue since it's affecting the fight against COVID-19?
Yes, so the Ghana Medical Association, the region, told them that since most of our members, the various specialties which Ghana Health Service doesn't have, and this fight is not about Ghana Health Service or the teaching hospital, it's about managing the COVID-19 center, managing the pandemic. So we agreed that the military hospital, which is not completed at Afari, okay, the ICU, I mean the emergency section is almost done. And what is left are some few things, and I think the major thing is the electricity to the center. Okay. So if that can be completed, and we were told that the health minister designate visited the facility and has promised that that could be done within 4 to 6 weeks, which we think is too such a long time, because on average, most of the deaths we keep repeating coming up from the region are not recorded because they die in private facilities and all that. So what we are recording are even more than what is being reported
out there.
So we made these proposals that if they can hasten the work at Afari, I think negotiations can be done between the government and then the military. It's a military establishment. But in this instance, there is nothing like the military and then the civilians. It's about Ghanaians. So
it's
if
about
we can
Ghanaians.
in the work there, and then we develop this because it's a big, if you've seen the place, the emergency is big and it can handle both all manner of critically ill patients. And the staff, I mean, the Ghana Health Service, Ghana Medical Association, the nurses, we have dedicated and indicated that we are ready to move to these centers.
Once it is ready. I'm grateful that you joined us. Dr. Pakwesi Baidu is Ashanti Regional President of the Ghana Medical Association.